Good afternoon, everyone. Welcome to our update for Erie County for August 26th. Glad to be joined by Dr. Gail Burstein from our Department of Health, as well as Karen Gambino from Deaf Access Services to provide the American Sign Language. And I thank everyone for being here today. Hope you're having a good day. As a reminder, the information in the PowerPoint is as current as the date of the presentation. Basically about an hour ago is when it was finalized. And sometimes things change, as we've referenced in the past. Before we get into COVID-19, I want to talk about a very important subject matter that we have to address as a community, and that's the census. It's very important for all county residents to respond to the census. Many programs, including federal road funding, are based on our population. So if people do not respond to the census, we're not going to get as much in federal funds, including for federal road funding, as we should. And we will lose, of course, millions of dollars over a 10-year period with regards to federal programs, and it'll hurt our representation in Congress, because if we are not counted properly, that means there will be less people to be represented under the auspices of how many people are in our region, which means we lose congressional representation. Thus, it's essential for all to respond to the census and do it now if they have not. We have some good news in that Erie County's total response rate is higher than both the state and national averages. National average is 64.5%, our state average is 60.4%, and our Erie County average is 68.9%. That's good. The bad news is we have a number of communities across Erie County that are trailing our average, and we need them to respond now. And if you live in any of these communities that I have on the screen and you have not yet responded to the census, we need you to do it. Buffalo has a 51.5% response rate. The town of Brant in the southern part of the county has a 53.4% response rate. Newstead has a 61.5% response rate in the northern part of Erie County. The city of Lackawanna, a little less than 62%. Town of Collins, southern part of Erie County, 64%. North Collins, 64.6%. Evans, 64.8%. Sardinia, 68.8%. All of those communities are less than our average. Why does this matter? As I said, federal aid is dependent upon it. A lot of those communities I referenced in there are smaller rural communities that are always talking about roads and how they want us to spend more money on roads. Well, if you don't respond to the census, we're going to get less money to spend on roads. And if you care about roads, and you care about funding for roads, you should invest in your community by responding to the census. City of Buffalo, there are millions and millions of dollars of programs that go to the City of Buffalo as a result of our population. Our senior services programs are funded partially through grants from the federal government based on our population. It's important that everyone respond. I've had some people say, I don't need to respond, it only helps certain areas. It helps everywhere. So if you like good roads and you don't complete the census, don't come to me and complain about the roads in the future. Simple as that, because you're hurting your own community. I need you to respond. We need you to respond so that we get properly funded and we have proper representation in Congress. There are ways to respond. The easiest way is to do it online. You can go to 2020census.gov. It's the easiest, most way, has multiple languages that are available, and you can do it on your smartphone. You can call over the phone, 1-844-330-2020 for English, or 1-844-468-2020 for Spanish. And there's other languages that are available toll-free. It's available in 13 languages. And if you need assistance in completing the census, you can do it at your local library. The libraries are prepared to help people respond to the census. You can go to the local library. Their hours and locations are on the website. But we need people to respond, and the last day to respond is September 30th. As you may have heard, the federal government has shortened the census timeline by a full month. We need people to respond. This is a huge, huge impact on our community. If you do not respond, we are losing out to other parts of the country that do respond. And I've seen the numbers for other counties across the United States. As I said, on average, we're doing a little bit better than the United States, but I know we are far below some of our comparable counties across the United States, especially in like the Midwest, Minnesota, Iowa, parts of the South. Counties that probably don't have any more people than us, but will be counted with having more people because their citizens are responding. I need you to do this. We need you as a community to do that, so I hope you will. And if you have any questions, you can call those numbers that you see on the screen, or you can go to the website of the library, talk to the folks at the library. They are prepared to answer your questions and actually help you respond to the census at the library. With that, I'll move on to COVID-19 case data. As of today, there were 9,365 total positive cases since the outbreak began. Out of 306,921 specimens tested, those are individual cases. They're not repeat cases, so it's 9,365 people, Erie County residents, who've had COVID or still have COVID-19. That's more than 10%, or excuse me, 1%, not 10%, 1% of our population. 678 people have died. We found out late yesterday, too late basically to report that there were 2 additional individuals who've perished as a result of COVID-19, and we certainly offer our deepest condolences to their families as well as the families of all the individuals who've died as a result of COVID-19. There are no these are all lab confirmed cases at the time of death. There's no presumed positives. And as of August 24th, there were 21 individuals admitted to Erie County hospitals for COVID-19. 8 were in the ICU. 5 individuals had an airway assist. Those are slight bump ups from where we were earlier in the week with regards to the ICU and airway assists, though the hospitalization numbers have generally stayed low, and we're all very happy to see that. Once again, the hospitalization data showing that we are very low, one of the lowest numbers we've had since the beginning of the outbreak. On total hospitalizations, though, we've seen a slight increase on ICUs, admissions, as well as airway assists over the last few days. And we want to keep those hospitalization numbers low, and the best way to do that is to keep the actual contraction of the coronavirus and COVID-19 down. West New York hospitalizations, there were 23 hospitalized and 8 in ICU as of the 24th. Just going back one, so there was 21 from Erie County. There's 23 in Western New York, so that means there's 2 individuals in hospitals outside of Erie County that are there for COVID-19. Cases by age and gender, you've seen this before, hasn't really changed a whole lot in the last few weeks. The number 1 age group are those 20 to 29. We've tested, out of all the people, the 300,000 that we've tested, the highest one to have the percentage positive are those in the 20 to 29 age group, then followed by the 30 to 39. Now these are also individuals who are out working, so it's not totally surprising that we're seeing that, but we did see a big bump up in the 20 to 29 and 30 to 39 from where there was a month ago when it was pretty even among all the age groups. COVID-19 case age groups, something that as I just noted, the 20 to 29, 30 to 39 has been one of the highest growth we've seen recently. And in the past week, there is a higher percentage than the average from the 20 to 29 group and the 30 to 39 group. There are actually, for last week in total, the confirmed positives made up 1.4% of all cases. So through the week ending August 22nd, which I believe is Saturday, 1.4% of all cases were positive, and 1.8% of cases for the 30 to 39 year age range, and 1.5% for the 20 to 29 were positive, so it's a little higher than the average. Though, as you can see, we still have some higher numbers than what we would like to see. Cases by residents, this has not totally changed, and gender. Females make up approximately 56% of all the positive cases, while males make up 44%. And we've seen a higher preponderance of cases in the city of Buffalo than we would expect to see based on the population of the city of Buffalo. We've been talking about this for some time now. 27.9% of all Erie County's population is in the city of Buffalo, and 47% of cases are from the city of Buffalo. The diagnostic and the testing rates, we've been fairly low. We have had some bump ups in the last week or two, including some days in which we were over 2%. But as we said, the last week we were 1.4% for all cases tested. And you can see here, this is giving you the average dating back to the week ending of July 18th. We basically had 1.3% for all of those weeks, with 1.4% being the last week. We really haven't dropped below 1% like the vast majority of the state has. So unfortunately, Erie County is trending higher in the last few weeks with regards to the numbers compared to comparable counties across New York State. That's not good. That's why the governor noted that Western New York has a caution flag associated with it. We had a date where we had over 2% positive, and we're going to continue to watch this and hopefully keep it down. We believe that this is generally from community spread. We've been able to identify if there are clusters, and there really aren't any large clusters. It's just cases all across Erie County. There are some family clusters. There's some cases in nursing homes. There's some cases in smaller numbers in businesses. But what we're finding out is the vast majority of cases are just individuals from across the county who may not be able to identify where they caught it from. And that's community spread. So that should remind us that we have to try to continue to follow rules as best as possible. As I've said before, and I saw, this is not me that's originated it, I saw it elsewhere, but I thought it was a good line. You may be over the pandemic, but the pandemic is not over. And I think we need to remember that just because you're sick and tired of the pandemic, you don't want to wear the mask, you don't care about it anymore, the pandemic's not over with. And we don't want to see those numbers go up. Antibody testing, it's still holding about the same, 6.7% total since we started doing antibody testing, 6.5% for, I should say, 6.5% since the week ending July 18th. One thing we have seen is a continual drop in the number of people who are getting antibody testing. So if you thought you may have caught COVID-19 in March and you're getting tested now, it's probably not really good. You want to do it within a certain time span. So we have seen a drop. We think a lot of the people who may not be concerned about COVID-19 because they don't think they have it in the last month or two are not getting tested, and numbers are going down. We still have COVID-19 antibody clinics available for free, and I'll let Dr. Burstein talk about that soon. But they are available, and the numbers are pretty much staying the same in that 7% range. The mortality data, still the vast majority of deaths are 70 and above, with the largest category being 80 above. We talked about this right from the beginning. The information that was coming out of Italy, that was coming out of China, is that this was drastically impacting those that were of advanced age. And we see that and continue to see that here in Erie County. And mortality data by residents, age group. City of Buffalo, the number of fatalities is actually below the percentage of the population. We've talked about this for a while, and we think that's an important thing to note. That unlike a lot of the other areas of the country with comparable sized communities where the fatalities are primarily occurring in their urban core, it's not necessarily happening here. And then the age count, there have been 9 individuals under the age of 40 who've perished as a result of COVID-19 since the beginning of the outbreak. And it just goes to show that just because you are younger does not necessarily mean you are invulnerable. Race and ethnicity, once again, we've talked about this. We've worked very hard with our partners, especially the Ignite Hope Task Force, the Racial Equity Task Force, and others, to ensure that we are not seeing a preponderance of cases, a majority of cases from African Americans or people of color, and we've basically kept it at around the same percentage for a long time now, where 16.5% of all fatalities are blacks or African Americans, and Hispanic or Latinos are 2.7%. Those are the black and African American is just a little bit above the population that you would normally see in Erie County, and the Latinos is a little bit below. None of this has changed a whole lot from what we've talked about in the past. And I'll turn it over to Dr. Burstein to talk about testing. She's the specialist.
Thank you. So we're still offering both diagnostic and antibody testing in Erie County through our public health lab. So for both, you would call 716-858-2929 to schedule. For antibody testing, there actually is an online scheduling option at erie.gov/COVID tests. So remember, this is no cost. We know that some people are struggling now to get a test because of cost issues. Health plans are not reimbursing for certain categories of screening tests. However, We don't charge anybody for any reason they want to get tested. We know that students are returning to school. Many times they want to get tested before they return. Travelers coming back, they want to get tested. So we will test anybody for no charge. So again, you don't need any type of physician's order or laboratory rec. These are by appointment only, so please don't expect if you walk up to our diagnostic testing, to our swab clinic, that we'll be able to take you in. With our antibody clinics, we can always take in another person. However, our swab clinics are very, very full. So, and then if you do schedule an appointment, please show up, because these are precious and people really want to get tested. You don't want to take their spot. So with our testing sites for our diagnostic testing through the month of September, we have clinics scheduled on Mondays and every other Thursdays in Williamsville, and then on Wednesdays and then the other Thursdays in Orchard Park. And soon, we've identified a site in the city of Buffalo, so we'll be able to move back our clinics to the city of Buffalo on Thursday once we get that all set, so everybody will have easy access. Also, for our antibody sites, again, we're throughout the county during the month. So coming up, we're going to be in Williamsville at the Harris Hill Fire Department, and then in Tonawanda at Sheridan Park Fire Department, and then following in September in Cheektowaga Senior Center and the Amherst Senior Center. So, again, this is a good opportunity to know whether you've been exposed or not, and also gives us some great information about what the proportion of people in our community who have been exposed and have some type of immune protection, although we don't really know what that means quite yet now. So if you want to go somewhere else to get tested, we have hopefully all the options on our Erie County website COVID test sites map. So each of the stars or the dots correspond to a testing site. So you just look on the map, click on a site near you, and a little window will pop up and let you know what type of test is done, if you need insurance or not, if you need a physician's order or not, and what type of testing is done. So we encourage you to look at that if you need a quick test at the last minute. Also, pharmacies are included in this. So now we will talk about Erie County Responds, and I'm going to turn it over to the county executive. Thanks.
Thank you, Doctor. Earlier today, I had a conference call with representatives of city, towns, and villages across Erie County. Actually, it was a WebEx call, so it was a video and audio call. And I informed them that out of our CARES Act funding, Erie County will be assisting villages, cities, and towns, reimbursing them for costs that were unanticipated in exchange or in response to the COVID-19 outbreak. We will reimburse municipalities up to $1 million per entity for hard costs such as PPE procurement, acquisition of laptops, tablets for distance working, etc. Does not include personnel costs. We do believe that most of these organizations, based on the conversations that we had, really don't have huge personnel costs with regards to responding to COVID-19. They don't have the health department, things like that, emergency services. We were providing them a lot of assistance throughout the time period. The dollars that are seeking reimbursement from some of these communities may be fairly small, but they do have costs. We can pass on those costs to our local municipal governments, and we will. There's a procedure that will be followed. They were described it today, and they're all receiving or have received by now an email explaining what we expect from them. Like other things, if they put in for money and it's eventually rejected by the federal government, we would seek reimbursement, because it's the county that's responsible for the money that was received under the CARES Act, and we'll be passing it on based on their requisitions to the county, and we will hopefully have that number from the towns, cities, and villages in the next month, so we'll know exactly how much it is. But we believe, we know actually we could reimburse each and every one of them up to $1 million, that we do not believe the vast majority of them will even approach that number, but we do want to reimburse them for their unanticipated expenses in responding to COVID-19, which is very similar to what we announced last week, which is school district funding, in which we will be providing $15 million plus for school districts and public charter schools to bring students and staff back to school safely or enable distance learning. We did not want to make it a one or the other. We wanted school districts to understand that we're there to assist them and is based on a pure pupil number, $100 per pupil across the board. And then if they're in a distressed poverty zone, basically if a student qualifies for the school lunch program, then you would get another $50 for that student. And the schools can use it in the manner as described for purchasing of personal protective equipment, sanitizing equipment, technology equipment for remote learning. Cannot be used for teacher salaries and things like that. It can only be used for sort of these hard costs associated with it that were totally unexpected. And we are very grateful to the support we've received from school districts since then. They are very appreciative, and already a number of them have filled out contracts to receive funding from Erie County based on the per pupil amount. And we expect that some of the first checks will be going out very soon with regards to the school district funding. The Erie County Emergency Child Care Task Force is working very hard. Right now, the task force has been working with Erie One BOCES and local school districts to develop plans for child care. The formal project, the program to assist with child care, will be announced next week. And we have a very comprehensive approach in place. We do expect to use some CARES Act funding for this. We know that child care is a huge issue for many of the families out there, including some of our own employees, in which we actually had a survey that was a county-related survey that we received the results from with regards to child care needs. And not just child care needs, there's also needs associated with elder care for those that are taking care of a senior member of their family. And so we're trying to address it as best as possible. We're asked parents to complete the following survey online so we have a better understanding of their needs. It's http://bit.ly/EC Childcare 2020. So ECCHILDCARE 2020. Please complete that. It's really helpful in what we need to do to properly respond to the child care need. And as I said, next week we'll be announcing one of the major parts of this program and the project, and more information will be coming then. Gym and fitness centers. I, through a blanket order, allowed gym and fitness centers across Erie County to reopen as of August 24th. We believe there are actually more than 600 gym, fitness centers, studios, and the like, based on a Google search that we did. However, not all 600 of them did what they were supposed to do, right, Doctor?
Right, only about less than 200.
Less than 200, to our understanding, affirmed and filed with New York State, as well as requested an inspection to be done by the Erie County Department of Health. What's going to happen is if you don't request the inspection, and we know about your place, our inspectors are going to come down and shut you down. We said, and I said last week when we announced this, that you have to have a safety plan in place. You have to affirm with New York State that you have this safety plan. You have to file that with New York State. You must request and pass an inspection from the Erie County Department of Health to remain open. Only those who did that were authorized to open on Monday. And only about a third of all gyms, fitness centers, yoga studios, and the like filed that with the county, the inspection form, inspection request form, and we are going to have to shut some of you down for not following the rules. It includes everything: dance studios, martial arts studios. They must follow the New York Forward Sports and Recreation Guidance for high risk. There's lots of guidances out there from New York State, but what we want the owners of these facilities to understand is I gave a blanket order to give you an opportunity to reopen, and if you don't follow the rules, we are going to have to shut you down. It's not a decision of, well, maybe we'll let you fly by. The rules are the rules. We have to inspect your facility. You have to have on file your affirmation with New York State. If you don't, we have to shut you down. You just spent a lot of time, probably effort and money to reopen, do it safely. And if you didn't follow the rules, you're going to get shut down. Please file your inspection report with Erie County. We will send an inspector out there. We now have a list of over 600 entities in Erie County that appear to qualify under the gyms, fitness centers, yoga studios, and the like. If we got your name, we got your address. If we go down there and see that you have your clients in there, you're doing whatever it is you normally do there, but you haven't filed an inspection report with you, we're going to shut you down. We don't want to. We don't. but we will because you haven't followed the rules. Simple as that. The governor allowed gyms and fitness centers to reopen. New York State did, but you got to follow the rules. And they're requiring us to do these inspections. And if we can't get the inspections done by a certain time period, they can't be open. Well, if you're not filing what you need to file with New York State and the county, you're going to get shut down. We don't want to do it, but we'll have to. So I'm saying that right now. If you haven't done it, do it. The Joint Travel Advisory, in effect for New York, New Jersey, and Connecticut, they have dropped a number of states. You can see there's actually a swath across the United States now in the gray that you can travel to when you don't have to quarantine, and there's a whole lot of red there just as much that you still have to quarantine. That rule is still in effect, but there are more states. And nicely in the Northeast, if you go anywhere in the Northeast, you don't have to worry about quarantining. That's a good thing because we got a lot of travel from people in the Northeast to New York, as well as people going from New York elsewhere. So that's a good thing. The number keeps on dropping of states, but that's still not as great as we'd like. I'll turn it over to the doctor to talk about COVID-related complaints before we, I think, entertain questions.
Thank you. I just want to add a little bit about travel. I mean, the past week, just from the airport, we received about 2,000 reports of people traveling to states in the governor's travel advisory. I mean, this is, it's on these states are in the governor's travel advisory because they have very, very high rates of disease. And they have high rates of disease because people aren't masking, people aren't social distancing, and so more people are exposed to disease when they go out. So, we really want to encourage people to think twice about traveling. I mean, I imagine probably double the number of people were traveling that we didn't catch. So, please think twice about traveling to these high-risk states. School starting, we don't want kids to return to school and possibly being an asymptomatic infected person and then, causing an infection or a little outbreak in the school. So, please think twice about traveling. So we, as the county executive mentioned, we are still receiving complaints about restaurants, bars, and businesses. If anybody has a complaint about a restaurant or bar, they can call us at 716-961-6800 or go to our Erie County Health Department website and file a complaint. There's a complaint tab that you can click on and file that complaint. So fortunately, this month we've actually been receiving fewer complaints than we did in July. So in July, we were receiving on average about 25 complaints a day about restaurants and bars. And so far this month, we're down to the average of about 15 complaints a day. And then we're also seeing this month that we're having much fewer violations identified. And I think because restaurants and bars have finally figured out how to do the right thing, realize that it's important, and we're just finding more restaurants and bars that are being and also banquet facilities that are being cooperative. So thank you. But again, if you walk into a place, you see like people standing, not wearing masks, large gathering, not social distancing, just walk out and leave. It is not worth it. There's a lot of places that have great food and good drinks. So you should patron one of those that are behaving. If you have complaints about other types of businesses that are not restaurants and bars, we don't cover those. So you would either call the New York Pause at 1-833-789-0470. Or they have an online form they can complete, or you can contact your local municipality building inspector or the law enforcement, and they can help you out. So we can entertain questions now.
Actually,
Hopefully you're done spritzing.
One final thing?
Sure.
One final thing. I think we all know that yesterday the Buffalo Bills announced that they will not be having fans in the first 2 games in September. It is as I predicted. Said if our numbers kept on going up, there was a very good chance New York State was not going to allow those fans. There have been lots of conversations over the last week with regards to fans attending the football game between the state, the Bills, and the county. We continue to work together. I know the Bills do have and are working with us and the state, a sort of return to the stadium plan. But because of the increasing cases and what New York State has a blanket rule with regards to professional sports of no professional sports fans being allowed into the games. They finalized it and said not for September. We still have a shot for October. We got to get our numbers down. If our numbers don't go down and we're still the highest part of New York State, I'm doubtful that we're going to see games in October be allowed. It's in everyone's hands. If you like going to a Bills game, be smart out there. Wear your mask. Try to safely socially distance when you can't. You can have small groups of people. That's okay, but you got to do it smartly. And then with regards to tailgating, the Bills working with us also agreed previously that if there would be no fans, they would allow no tailgating in the county-owned Bills lot, so to speak. State agreed. We also will not be allowing tailgating in private lots for health reasons. We are very fearful that people will be there all day drinking and not following the rules. They're also very fearful of buses and large vehicles coming to these private lots and basically being there for extended periods. And we know that's how COVID is shared. I think the Bills have a pretty good plan if they can get fans back in to protect the fans, but it's not foolproof. We know that. But until such time as our numbers go down, I doubt we're going to see fans in the stadium. So we might have fans in the stadium in October, but we got to get our numbers down. And if we don't get our numbers down, I doubt the state is going to allow fans in the stadium. The Bills would like to have their fans return at least to some percentage. We know it would never be 100%. Certainly, not in this era. But we would have some fans return. And I think the only way it's going to happen is if we as a community get our numbers down. It's as simple as that. Entertain questions. Marley.
How do you, on that note, how do you monitor residential private lots who, under state law, can have gatherings of up to 50 people? Is that on the Orchard Park Police Department? Is that on you guys as in county sanitarians?
The difference between, backtrack, you can have a party in your backyard. You can invite your family or neighbor as long as you keep it within underneath the numbers. Once you start charging for someone to park there, you're a business. And it's funny because a lot of the private lots, on Sundays, they love when the people come, except when the IRS or New York State Department of Taxation agent walks to the door saying, I just counted 100 cars and vehicles and you're charging $25. Are you declaring that? So you can have people over to watch the game, and a small amount is approved. As long as you're not charging, that's okay. If you decide, okay, like the private lots, because this is a business for them, or ancillary income for those who use their own personal yard to do it, you're now a business, and you can be regulated. You could be regulated by the county, you could be regulated by the town, you could be regulated by the state. Some of these lots have porta potties. Now, I don't think I'd want to be using that porta potty if there's a whole hundreds of people in that lot in the age of COVID, but they're required by law to provide porta potties based on the number of people that are in the lot. So this is not, we're not banning what would be considered tailgating for someone just to do it in their backyard or to invite some friends over to watch the football game. What's prohibited is a business from charging someone to actually go onto their premises to park there and tailgate all day. I think, Ron, you were next. You had a question.
Okay. Thank you.
If you don't want to.
Yeah, might as well. You mentioned most of the recent cases are community spread, but you did say there's some clusters, I believe, in businesses and nursing homes, also families. Will you name those businesses and nursing homes? If not, why not? Do you really think HIPAA still applies, even though some experts are telling us that's really a stretch not to name a location? And finally, do you think that's really in the public interest going forward?
Well, as I've noted before with regards to releasing of information, case data, and who's had it, we don't release the individual's name, but we also don't release information that could otherwise identify the individuals, unless there is a direct risk to the public. We have the ability to quarantine someone if we feel that they're a direct risk to the public, if they have COVID-19 and they're not following proper guidelines. I would note that when we talk about clusters, we're talking about a handful. We're talking about less than 10 cases. And that's a thing that really kind of is a bother because there's over 300 cases that happened last week. And like the last week, we had no cases that were like 60 or 70 attributable to one thing. And I think it's important for the public to understand, if we believe that there were individuals at risk, we'd be identifying, or at least not identifying the individuals who have COVID, but we'd be saying, here's the things that we want to do to take advantage of it, and to give people an opportunity to protect themselves.
So will you be identifying businesses going forward or locations?
We'll be identifying locations if it's a risk to the general public. I mean, as I've said before, people are like, well, what supermarket should I be careful about going? And what store should I be worried about? And I said, it's all major stores. There's a reason why it's called community spread. It's because it's all over the place. I mean, it's as simple as that. And so
Mark, why do you think other communities like Madison County, obviously Fieldville Farms, or Fieldville Foods, as we heard about, they're sharing this information. Why isn't Erie County, again, about Eden and situations like that?
we talked about Enon last week, Ron.
We did.
And I asked you to note, because this station kept on saying that I was hiding from and unavailable for comment. I was on vacation. I didn't even know about what was happening in Enon because I was in the mountains of the Adirondacks. Couldn't get cell service until after we actually had been made public. That happens. I was on vacation. First full week's vacation I've taken since last year. That's part of this business.
Did the
But
Deputy County Executive have been able to tell us?
I do know, because we can't provide information that can identify individuals.
And location, because again, we consulted with other legal people, other legal opinions. Oh, you're an attorney. And they're saying, yeah, personal identifiable information, but not locations. That's a quote stretch.
Well, you're asking me to identify information that would potentially show how an individual, where they lived, how they caught it. And truthfully, also where they worked if it's not a risk to the general public. I'm sorry, but we believe that the law is on our side and we're protecting individuals. I mean, if the outbreak in media outlet, you wouldn't want that public, even though there were individuals in the media who caught COVID-19 in the last few months, it's my understanding. So I'm sorry, but that's just how it goes. It's up to the state to talk about nursing homes. And if there are cases, and I believe there are a few cases in nursing homes, as there have been a few cases in nursing homes for a long time now, there's been no week since probably late March, early April, where there hasn't been a case in a nursing home. It's up to New York State to reveal that. Michael.
Mark, is this going off of your own personal legal opinion, or is this something that you consulted with the Erie County Attorney on, whether or not to name the locations? Because as Ron had mentioned, we're hearing about these places that are happening in other counties of Western New York, and people are still wondering, why can't specific places be named here in Erie County?
Well, first, I'm not going to talk about what was done in other counties. I just know what we've been advised from legal counsel.
So it was the Erie County Attorney that had mentioned.
Well, it was legal counsel. It was the Erie County Attorney's Office or others, including New York State and recommendations from New York State. Sandra? you
And
want-
I do actually have a completely different question, but just to follow up briefly. Right now, I think the media is getting more information about general categories of where these clusters are from the governor's office than we are from Erie County, and I think that that's very frustrating for us. I mean, the county wouldn't even say, we're talking about an agricultural business when it comes to Eden, so just put that out there. But my question is in regard to the money that's going to municipalities. Is that backward looking? Like if
Yes.
municipalities, okay, so back to like March when they first spent
The question was, the money that'll be going to municipalities, is it backward looking? And the answer is yes. Basically from the date set in the CARES Act, because the CARES Act set a date saying all unaccounted expenses, or unbudgeted expenses, I should say, that were directly related to COVID-19 response, starting as of this date, I think it's March 23rd. So any expenses that were incurred up to $1 million that are not personnel in nature would be eligible for municipalities, which are cities, towns, and villages.
And is part of the reason the county can make this money available because you guys don't have the ability to carry over the federal stimulus money to next year for future costs?
As of right now, there is no carryover. The money has to be out the door and spent by December 30th. And the federal government guidance has said we can actually provide this assistance to governments, school districts, and the like. We believe we can also do it for certain child care expenses, not all child care expenses, but certain ones, and that's why we'll be announcing something next week with regards to child care and the use of some CARES Act for that. There are a number of things that the federal government allows us to spend CARES Act funding on, but it has to be in direct relation and response to COVID-19 as of that one date, which I think is March 23rd. And we cannot, if we don't spend it by December 30th, we have to return the unspent amount. And it truly would make no sense for us to have money left on the table that could have been used in our community to reimburse governments that are hurting, school districts that just heard they got a big 20% cut in funding from New York State. So it made sense for us to utilize those funds while we had it, because it would be silly to leave that money on the table when truthfully other governments are doing the same thing.
Mark,
Michael?
what's your advice for people who are having issues when it comes to childcare? I know the survey is out and you're going to unveil results next week, but what's the county going to do with that survey information to help alleviate some of these issues?
Michael, I would just say with regards to child care, I would wait until next week, because the Deputy County Executive, Maria White, with our Department of Social Services, Commissioner Marie Cannon and others have been working with the Child Care Resource Network on coming up with a project and a plan. And I pretty much said, you guys handle it. This is not my bailiwick. So you guys come up with this. I'm dealing with other issues, including, at this point, trying to run a government in all the other 30 departments in addition to the COVID-19. So they're handling it, and more will come on that next week. Yes.
With the higher positivity rates in, the 20 to 29-year-old age group, how concerned is the county that those numbers might get higher with the return of students coming back to colleges?
We are concerned about all returning schools with regards to students coming back, all ages, not just colleges. We know colleges are a flashpoint, and we're seeing it in the rest of the country. University of North Carolina basically opened for a few days, shut down. University of Alabama just announced hundreds of students testing positive after basically a week. So we are very concerned. I'll turn it over to Dr. Burstein, because she's had direct conversations with a number of the colleges and their plans, which I think are, what I've heard, are pretty good. But you can't stop stupid sometimes, and college students aren't necessarily known for making the brightest decisions, especially at midnight when they're out partying with their friends. And that's how COVID could get passed. So I'll turn it over to Dr. Burstein to talk a little bit more about the conversations that she's had with colleges.
Sure.
I don't know if we...
Thanks. So, yeah, actually, regarding higher education, so actually I was on a call this morning with a group from the University of Buffalo talking about plans for testing and contact tracing. So I think all the higher eds are very concerned. They really want to keep the schools open. They want to keep their kids, their students on campus as much as possible. So they're making plans for students to get tested, both when they're symptomatic, when they're contacts, and also for asymptomatic surveillance, which is going to be tough now with the health plans not reimbursing for this form of testing. They also have, strict guidance around about social gatherings. Many of the classes are going to be virtual or hybrid, where they'll be virtual and maybe a little bit in person. Labs really have to be in person. So I think the universities are all trying to make a great effort. I mean, the state has provided some solid guidance for universities to use to try to make their schools a safer place for students, and we're a resource for questions. So we're hoping that we'll be able to get it right. Also, what we have with the other states where they've had huge outbreaks are that our rates, even though we've had like a little bit of creep in the past week, a very small amount of creep, our rates are still very, very low. So these university, there's actually just been I think a publication in JAMA that shows that a major prediction of like how high rates in schools are the community rates. So it's really reflective of the community rates. So as long as we keep our rates down, the schools have a better chance of keeping their numbers down and preventing any type of transmission within those school communities, whether it be K through 12 or the higher education. And also, if in the slide, if you notice, when we looked at the proportion of positive tests among each age group, it's really now, it's people in their 30s that have the highest proportion of positive tests. So for this past week, of the people who were tested that were between the ages of 30 and 39, 1.8% were positive, whereas the people who were tested who were between the ages of 20 and 29, 1.5% were positive. So so, those are close numbers, but however, that, it's not just people in their 20s, it's people in their 30s that should have a frontal lobe. And so they should know that they shouldn't have to, they should try to avoid these group gatherings and plan ahead to have masks. So it's more than just people in their 20s.
Dr. Bernstein?
Sure.
What is the Erie County Department of Health doing to accommodate schools and the various sorts of reopening plans when it comes to testing? That seems to be one of the things at the forefront when it comes to schools.
Right. Well, we know that unfortunately there's a national shortage of tests, not just the test reagents themselves, but also what we call consumables. The pipettes and the tubes and everything that we need to run the tests. So the problem, there's a national shortage. So we've been very frank with the schools that they can't rely on us to do all their testing. We have been trying to get our ducks in a row to be prepared if, in case there is needed to be a large amount of community testing associated with the school. We can't promise anything. We've been reaching out to our partners in the hospitals. We've been reaching out to our partners in the states. We're doing everything we can to build our capacity. But the fact is that there is a national shortage of tests. And we can't guarantee that we'll be able to do testing for the schools, and we've been very frank with that. We have our COVID-19 test website up, so families that really want to get tested and they're concerned that their children may have been exposed, they can go to our website and find different locations and resources for getting testing. I mean, it's a national problem and it's a community problem, and so again, our community has stepped up and work together to address different problems, and I think our partners that offer testing are our hospitals and the state lab is they've said that they'll help us if we need help, and we'll have to take it on a case by case basis. We cannot guarantee we'll be able to do all the testing.
And specific with schools, how much does the news about local insurers not covering certain people who want to get a test, how much does that amplify the concerns that you have about schools opening?
So the question is about how the insurers not covering all reasons for testing is going to affect the ability for families to get tested with that they have students or anybody that could have been exposed. So my conversations with the health plans is that for exposures or symptoms, they'll still reimburse. However, they're not going to be reimbursing for asymptomatic screening. And I think that we know that a big strategy to a key component of getting through this COVID pandemic is testing. And any single barrier there is to testing is going to be a problem for us being able to get to the other side. So it's very concerning to us that the health plans are limiting the type of testing that is being done. I mean, we need as many people to get tested as possible.
Do you expect the positivity rate to increase since fewer people would be able to go to, say, an urgent care place to try to get a test, even if they don't have any symptoms, they're just doing a regular checkup? Will the rate increase?
So the question is, will the proportion of positive tests increase if the denominator is changing, where we're seeing less people who are asymptomatic and maybe not have a particular risk factor getting tested? Yeah, that could happen. I mean, we are keeping track not only of our numerators, a number of positive tests, we're also keeping track of our denominator, the number of people getting tested. So that's a good point. We are following both of those numbers.
You had a question?
Yeah, really quick, for the kids, these students in local public schools, private schools, with the test shortage, I mean, would you then just advise kind of what we've been doing this whole time, where if these kids feel said symptoms, to stay home for X amount of time? Or I've just been talking to a lot of parents and they're nervous on that front.
Right. So the question is, how is testing going to work with K through 12 schools? So there actually are some pretty tight guidelines that the state has issued, and we've heard they're going to issue some additional guidelines of what to do when a student has symptoms and they present at school. And so there's a very clear protocol that the students they cannot come to school if they do develop symptoms in school. They have to be isolated, removed from school to get a COVID test. And so, and then depending on what the outcome of the test will be the next course. But there are some pretty tight guidelines about what to do with students who are in school and develop symptoms.
Sandra?
Yeah, I have a question for him. Erie County is one of the few major employers that's requiring all of its employees to work from the office. I know that there have been objections raised by the unions, by the comptroller's office, by many individual employees who said they're trying to make the decision about whether or not to continue working for the county or to quit. Your personnel office, I know, is exploring some options in this regard, and I was wondering if you could give us an update about the possibility of there being a remote work plan permanently or temporarily for...
Well, the question is with regards to remote work plans. Under our union contracts, we have to negotiate a remote work plan. There right now is no authorization or proper agreement with regards to remote work plans. We did put out a survey for a reason. We wanted to see what it was, a lot of our employees, their issues, how many of them had to deal with child care, how many had to deal with adult care. That they hadn't necessarily thought of because they normally would work 9 to 5 or 7 to 3, 8 to 4, and their children would be at school, or sometimes you have adult respite facilities in which adults go during the day to a respite facility, then go back home at night. So we're exploring all options. We do consider on a case-by-case basis requests for work at home. Just because someone's like, I don't want to work at home because I don't want to come into work is not a legitimate reason. We've spent a lot of money and created a safe environment, very safe environment. And I think you're seeing it because there's a lot of employers that are now returning their workforce. And so we are working with the Personnel Department and the Labor Relations Department. They're having discussions with the unions. But first we need to get a response back from our employees to figure out what are they looking for. And the problem is, I've heard it from some, and I know when we saw the numbers associated with those who were working from home, there were some who actually their efficiency was way up, was above what their efficiency was when they're here, and there was a whole portion of them where the efficiency was way down. And so what our goal is to ensure that we have a workforce that works for the people of this community, because there's needed services where a lot of those jobs have to be done in the office. You cannot do certain jobs in county government from home. There are other jobs that potentially could be done from home, but we're trying to treat everyone equally. So we're examining that issue right now. Unfortunately, some school districts don't even know if their students are still returning to school in 2 weeks. And that's a big problem because we got the survey results back, and I saw the initial survey results, and some parents are like, I don't know what's going to happen. I don't know if my kid's going to be in 5 days a week, 2 days a week, no days a week. And that's an issue, and that's what we're working from because we have a united workforce. And there's individuals who have to report to work. And there's others that potentially could work from home. And there's also some jobs where if they work from home, there's nothing they can do because they have a job where they can't do it from home. So it's all part of the overall discussions we're having with our partners.
I just know that, for instance, social services, which is your largest department, I mean, there are many people there who have school-age children and for whom the school thing is a big issue, who have said they are been working very hard.
We have every department that has. I know individuals that are married that work in the sheriff's office in the jail division, and they have children, and they have to work. You can't just say, I'm going to work from home for a jail. You can't do that. I mean, so you have to have a plan to provide the services that we do. Everyone focuses on a narrow subset, but we have services across the board that you often in these jobs have to have people there. I mean, there were a number of offices that were necessary that were shut down. I mean, people that were complaining about why can't I get my license renewed or I need to get driver's tests. And basically the DMVs were shut down because you can't do that from home. So there are certain services that are always going to have to be done in person. And there's others that potentially could be work from home. We're working with our partners to address that issue. So we've had conversations through personnel and labor relations. I've had conversations, that I should say that, with CSCA President Denise Shimura. And I think we all understand that this is going to be a very large task to handle, but we're working on it.
You don't have a time frame for...
The time frame, as I say, some people were very angry when the Buffalo Public Schools made their decision about basically the first quarter. I didn't have a feeling one way or another, but I was happy they made the decision. I was very happy they made a decision, because at least told the parents what to expect in the first few weeks. And what's disappointing is there's some school districts out there that still haven't made a decision. And we need them to make a decision. I need them to make a decision as a community leader. I need them to make a decision as the employer of parents who have children in their schools. And so not everyone was happy with the decision, of the City of Buffalo School District. Other people were thrilled. I didn't have like a particular issue myself, but I was very happy that Kreiner Cash came out there and said, here's what we're doing. And I would hope that all other superintendents would do that, because the parents need to know and the employers of the parents need to know. One more question.
Is there any chance that schools might get another boost from you if you have money left over in the COVID funds?
The question is there another chance that schools might get a boost? I guess they could, but at this point, we're not anticipating it. We have other expenses that we know we're going to incur through the remainder of the year. And there is still the possibility that Congress could pass a bill allowing us to use that funding to offset our revenue losses. But I decided, as the county executive, in my purview, to, you know what, I'm not going to wait for Congress to act. We might be waiting till hell freezes over for Congress to act, especially in an election year. So let's start spending this revenue that we receive from the federal government in areas that we can. And if the county can't spend it, let's help our partners locally, school districts, cities, towns, and villages, pay for the costs they've had to incur that were completely unexpected at a time when they've had revenue loss. We've had revenue loss, but we received the CARES Act funding to offset costs associated with the response to COVID-19. Couldn't put it for revenue holes? We didn't. We're doing the same thing with this additional funding, or not additional funding, but this funding for school districts and the municipalities is allowing them to reimburse some of the unanticipated, unbudgeted expenses associated with COVID-19 response while they still have huge holes in their budgets otherwise. Thanks, everyone. Have a good day. We will be holding these as needed. We may not have them weekly. We didn't have these weekly before. I think you know we held a press conference as necessary. As I said, I was off 2 weeks ago. I was on vacation. Last week, it was a crazy week. That's what happens when you come back from vacation, so it wasn't always fitted in. We will have press conferences as necessary and needed. If there's an emergency situation where we have to go and speak to the public, if something happened overnight and I got to speak to the public with Dr. Burstein tomorrow, we'd have a press conference tomorrow. But we're not necessarily staying and saying we're going to have a press conference every Wednesday at 2:30, which I know for some people out there, they're very happy about because we keep on getting calls and emails. Don't interrupt my soap opera. Take care, everyone.